Hello, my name is Jane. I am a therapist and welcome to my practice. I have recently received a letter addressed to me about a mental disorder called histrionic personality disorder or HPD. HPD is characterized by a long-standing pattern of attention-seeking behavior and extreme emotions. When attention is not granted, they become extremely depressed and upset. People with this disorder have tendency to become bored relatively fast and do not do the same routine every day. They crave immediate gratification for an action or task, and many have troubles with long-term relationships due to these issues. A person with HPD is also very manipulative and seductive. HPD made its first appearance in the Diagnostic and Statistical Manual of Mental Disorders. It is the only disorder that kept the term derived from the ancient concept of hysteria. Hysteria dates back about 4,000 years. In the mid-19th century, Ernst von Feuchtersleben made the first psychosocial description of what would become HPD. A series of other historians including Ernst Kreismer, Wilhelmina Reich, Otto Fenichel, Eser, and Lesser, Zetzel, Horowitz and authors like Theodore Millon contributed to further the suspicions and create a definition of HPD. HPD occurs in about 1.8% in the general population. HPD is a pretty straightforward disorder, so there are no other forms, but a patient may have a more severe case depending on the time of diagnosis and their environment. HPD is mostly diagnosed in adulthood, mid-20s. To be diagnosed as a child or adolescent, the symptoms must be present for at least a year due to the constant development and personality changes that comes with maturation. When the patient gets to be about 40 or 50, they will experience less extreme symptoms as the disorder decreases as age increases. It is shown in statistics that women are more likely of being diagnosed with the disorder than a male, but on the contrary, my colleagues believe more male have it. It's just they have not been diagnosed. As for ethnicity, it has not been proven yet. Speaking about being diagnosed, HPD is typically diagnosed by a mental health professional such as a psychologist or psychiatrist. A healthcare professional will look at the symptoms you are experiencing, how long they have occurred, your life history, recent behaviors, your overall appearance, psychological evaluation, and the overall severity of the disorder to see if it matches the criteria to be diagnosed as HPD. The doctor will do a psychological test or evaluation upon diagnosis. HPD is a very complicated disorder. Doctors are unsure, but there may be a possibility that it is passed down through genes. There are multiple theories that include the child's inherited genes and the environment of their upbringing that weigh on the disorder. Doctors also have a theory that the environment learned with their coping skills on how to deal with stress-related issues can be a factor as well. Although there is no actual cause, making for no one single cause, and multiple theories are intertwined to make one big logical cause for the disease. Symptoms include acting or looking overly seductive, being easily influenced by other people, being overly concerned with their looks, being overly dramatic and emotional, being overly sensitive to criticism or disapproval, believing that relationships are more intimate than they actually are, blaming failure or disappointment on others, constantly seeking reassurance or approval, having a low tolerance for frustration or delayed gratification, needing to be the center of attention, and quickly changing emotions. The treatment available include psychotherapy or talk therapy, medicine for specific troubling symptoms, and support groups. Medication is least likely to be used as the patient can use it to threaten harm upon themselves. I strongly recommend talk therapy. Since there is no known cause, there is no cure, but symptoms can be reduced with treatment and medicine or may eventually minimize itself. The same goes for prevention. There is no true prevention, but if you are a parent, you can try to raise your kid in a pristine environment. If you have a friend with this disorder, you just really need to give them support and encourage them to take their medications and or go to therapy, as most don't due to disbelief. Well, until we meet again. Ta-ta for now.